together to develop the global strategies that we need to cope with the problem and threats that women face in every society, in every culture, in every nation of the world.
This is an ambitious agenda, but I know that each of you believes, as I do, in a safer and healthier future for womanhood everywhere.
Welcome to the University of Pennsylvania and the first Penn Summit on global issues in women's health. Welcome to Philadelphia and the home of America's first medical school, first teaching hospital, and premier school of nursing. Yes, come on. Welcome to a university whose founder, Benjamin Franklin, saw the relief of human suffering and the betterment of the human condition as the ultimate aim and end of all learning. Those are Franklin's words, prescient as they were. Welcome to a campus that embraces the ethos of putting theory into practice and letting real-world practice lead us to new theoretical understandings. And welcome to the 21st century, in which, alas, the reality of inhumane suffering, early death, preventable disease, and needless privation are all still too commonly with us. Indeed, these afflictions have reached absolutely staggering proportions, barely imaginable in that early, more optimistic age of Franklin and the Enlightenment. To their credit, Enlightenment philosophers did imagine today's great movement toward a world in which each and every individual, regardless of gender, is accorded full and equal human rights. A world in which human dignity, health, education, and political participation are the rights of all, not the entitlements of the few. They imagined that as the absolute destiny of human beings. What they didn't imagine is how long and hard it would take to get to that destiny, and how not inevitable it was. Today, that same vision of equal human rights to all, regardless of gender, race, income, creed, that same vision belongs to diplomats, philanthropists, businessmen and women, and the global network of NGOs, human rights activists, and relief workers, many of whom are with us today. It is also the vision of far-seeing politicians, We need more far-sighted public officials because politics will be central to our task of developing effective strategies to tackle global problems of women's health. As a political scientist, I gauge the distance between philosophical theory and human reality, and one lesson is clear. None of our enlightened visions of human potential and fairness can be realized if the inhabitants of a society are ill-fed, unclothed, subject to rape, violence, and sudden death. Democracy cannot exist in a Hobbesian state of nature where life is, as Thomas Hobbes famously put it, poor, nasty, brutish, and short. Human beings cannot live satisfying and productive lives in a state of nature. Knowledge and health cannot flourish in a state of nature. And today, too many women, our sisters, live in a state of nature not of their own creation. That is why we are here. We have come together in a great and grounded cosmopolitan spirit. From 31 countries, from education, politics, communication, medicine, nursing, law, public policy, social work, and dozens of other fields of human endeavor. We have come together to share our knowledge, our experience, and our grounded optimism that things could be different if only more of us put our minds to work, our bodies to work, in doing what needs to be done, all the more urgently in this century than ever before, and all the more possible in this century than ever before. There is no excuse not to do more. We have come together to do what none of us can do separately, to understand the threats to women's health and safety in their global context and global impact. We have come together to develop the global strategies that we need to cope with the problem and threats that women face in every society, in every culture, in every nation of the world. There is no university in the world better suited to host such a discussion than the University of Pennsylvania. Excuse me for my modesty. On what other university campus could deans of nursing, of medicine, of social policy and practice, communication, education, and arts and sciences come together to lead discussions on the threats to women's safety and health around the world? The people of Penn have a great willingness and ability to integrate knowledge for the betterment of humanity. And no one deserves greater credit for Penn being so poised than my predecessor as Penn's president, Judith Roden. As a psychologist, Judy led the way in understanding the complex interactions of psychology, physiology, and behavior in obesity, anticipating our current national crisis by decades. Judy helped to launch the women's health movement and led the MacArthur Foundation's network on health and behavior. At Penn, Judy had a vision and laid it out, a vision of leadership and excellence. She led the revitalization of West Philadelphia, which has become an international model in urban revitalization and renewal. As chair of this summit, Judy has, from the very first, before she stepped down as president, been an ardent advocate of this conference and the values it embodies. She encouraged the partnership led by Afaf Malise and Arthur Rubenstein. She encouraged this partnership between Penn's School of Nursing and School of Medicine, and quite a partnership it is. This remarkable partnership, joined now by Penn's other 10 deans in their schools, has made this conference a reality. Today, as president of the Rockefeller Foundation, Judy leads one of the world's great philanthropies. Issues of global health, human rights, and the lives of women are central to its mission. So I can think of no one better able to begin our conversations about the global threats to women's health and safety and the practical strategies needed to counter those threats and better women's lives around the world. It is with great pleasure that I ask you to join me in warmly welcoming the President Emerita of the University of Pennsylvania, our summit chair, Dr. Judith Roden.
Thank you so much, Amy, for those extraordinarily gracious words. I must say that it is great to be back at Penn, which of course has such a special place in my life and in my heart. And it's wonderful to see so many of you, my old friends, and I know to meet so many wonderful new friends in this conference. I salute Penn School of Nursing and Penn School of Medicine for convening and for hosting this important summit. Of course, in doing so, they're doing what great universities ought to do, and that is expand our understanding, expand the bounds of knowledge, and really help to focus and push us to think about new directions, to really galvanize the energy. And I felt so much energy in that hall outside as we came in, so I know we're going to harness that in the next 2 days and then going beyond. This is a much needed discussion, and there have been so many. In some ways, I think we can answer the question today of why another, and I think we all know why. But no matter how many meetings there are, somehow we've not been able to really collectively move the agenda forward and move it to center stage, and that certainly is one of the major goals of our sessions in the next 2 days. The summit will speak to the types of partnerships and collaboration that is needed in order to create a culture of safe and healthy womanhood. Our partnerships at Penn began, as President Gutman told you, with a partnership between the School of Medicine and the School of Nursing, but it spread like wildfire among the deans and the other schools because everyone recognized that it was really such an extraordinarily interesting and compelling multidisciplinary problem. So the School of Social Work, now the School of Social Policy, dental medicine, arts and sciences, education, the Annenberg School for Communication, and then now with continued support from the Hassenfeld Foundation, the Gates Foundation, and the Carnegie Foundations, and many other private donors, we are seeing the energy really accelerate on this campus. With your presence, our colleagues now include 31 more countries, and we see this very much as a growing momentum-building energy exercise. Working together, there's just so much that we can accomplish, and so I add my voice of welcome to Amy's to the summit. I think it will be a marvelous, exciting 2 days. What can we expect? Through collective action and collective vision, I am confident that we can create a culture of safety for women, a culture that recognizes that safety and education, employment, and human rights, all of these affect a woman's health, and that in turn, women's health affects family, community, and a nation's social and economic development. With this summit, we can continue to document and decry women's suffering with, as poet June Jordan phrased it, an increasing revelation of the intimate face of universal struggle. To help us understand the scope of this struggle, we have a truly outstanding international program of speakers. Their insights will challenge us to stretch our thinking and expand our understanding of the plight of women on every continent. We will learn more about the scourge of international trafficking of young girls for prostitution in Africa, in Asia, in Eastern Europe, and elsewhere. We will deepen our understanding of the struggle for human rights in Botswana and other African countries. We will hear about the growing number of women living with HIV/AIDS. Together, we will explore what Donna Shalala, the Secretary of Health and Human Services in the Clinton administration, called domestic terrorism, the violence against women that happens in the homes of millions of women in this country and across the globe. Working shoulder to shoulder over the next 2 days, we will also address the issue of gender inequality, an issue that traps far too many women in a cycle of limited education or no education and no training. And we will discuss women's dramatic underrepresentation in the political arena, disturbing overrepresentation in poverty, and appalling discrimination in education and literacy. Most important, we will look at what all of these elements mean for women's health and safety. And when it comes to women's health, some startling numbers bear repeating, numbers I'm sure most of us in this room know well. Every minute, 5 more women become infected with HIV. Of all the adults living with HIV, now nearly half are women, and over 2/3 of those women live in sub-Saharan Africa. More than 50 million women suffer from poor reproductive health and serious pregnancy-related illness. 500,000 women die each year from complications in childbirth. In high-fertility African countries, women have a 1 in 16 lifetime risk of dying from maternal causes. This reality is captured in what Tanzanian women who are near the time of their delivery say to their older children: "I am going to fetch a new baby. The journey is dangerous, and I may not return." To these astonishing facts, add the staggering statistics on violence directed at women. Between 1/4 and 1/2 of all women in the world have suffered abuse from intimate partners. Gender-based violence is now one of the leading factors in increased rates of HIV infection among women. In cultures in which very young girls are given in marriage to much older men, they face even greater risk. In some countries, nearly 1 in 4 women experience sexual violence with an intimate partner. Add to this the hundreds of thousands of women and girls throughout the world who are bought and sold into prostitution or sexual slavery at an estimated rate of 2 million a year. According to Amnesty International, human trafficking is now the 3rd largest source of profit for international organized crime after drugs and weapons. Over the next few days, we will hear much more about all of these issues. Our keynote speakers and our wonderful panelists rank among the world's foremost thinkers and leaders in recognizing society's impact on women's health. What we hear will highlight why improving women's health is critical not only for social justice, but also for achieving wider social and economic development goals around the world. Speaking 10 years ago at the UN 4th World Conference on Women in Beijing, then First Lady Hillary Clinton presented the challenge this way: if women are healthy and educated, their families will flourish. If women are free from violence, their families will flourish. If women have a chance to work and earn in full as equal partners in society, their families will flourish. And when families flourish, communities and nations will flourish. We know, a decade after Beijing, that far too many families are not flourishing. Far too many women are uneducated, live in poverty, are victims of domestic violence, and lack adequate health care. Far too many children are dying from malnutrition, denied the right to go to school, or forced into prostitution and slavery. We must give voice to these women and children in the best way we can, with our knowledge, our research, our policy work, and our passion to make a difference. We must work together to ensure that policies in every country value women's health, that laws worldwide protect women's rights, and that governments everywhere commit to improving women's lives. We must persuade our universities, our religious centers, our medical communities, and our states and neighborhoods to study and provide solutions for the problems of women's health and safety, just as we must prod the media to convey our outrage and promote our strategies for change. If we are to one day see all women safe in an unsafe world, we must make the concerns of women in Botswana the concerns of women in Beijing, the campaign for women in Bangladesh, the campaign for women in Belarus, the struggle for women in the West, the struggle for women in the East, and the opportunities for women in the North, the opportunities for women in the South. Yes, this is an ambitious agenda, but I know that each of you believes, as I do, in a safer and healthier future for womanhood everywhere. Helen Keller had it right when she wrote, "Although the world is full of suffering, it is also full of the overcoming of it." Over the next 2 days, we will name the suffering and identify the steps to overcome it. We will also establish the context by which women's health issues are defined and presented and discussed. This summit will be an opportunity to define some of the best models of social action and care, ones that could improve women's health and create a culture of safety. And we will learn from one another the best practices and strategies to improve women's lives and health. We have an ambitious agenda ahead of us, but our goal is ambitious. Nothing less than a healthier, safer future for all women. A future in which women will enjoy all of the protections and advantages society can provide. Perhaps Simone de Beauvoir said it best: when we abolish the slavery of half of humanity, together with the whole system of hypocrisy that it implies, then the division of humanity will reveal its genuine significance, and only then will the human couple find its true form. Thank you for being here to take part in what I know will be a fascinating exchange of knowledge and of strategies and of solutions. We have great work to do, and now is the moment to move women's health and safety to center stage in our thinking, in our practice, and in our vision for a healthy future. Thank you, and again, welcome to the summit. Thank you. I now have the very great pleasure of introducing Dr. Mary Robinson, the first woman to be elected President of Ireland, who has been a leading advocate for human rights throughout the world. As president, she was the first head of state to visit Rwanda and Somalia following the crises in both countries. For her efforts on behalf of Somalia, she received the Special Care Humanitarian Award. With the conclusion of her presidency, Dr. Robinson served until 2002 as the United Nations High Commissioner for Human Rights. A renowned expert in constitutional and European human rights law, she served on the International Commission of Jurists from 1987 to 1990, and during the 1980s and 90s was a member of the Advisory Commission of Interrights. She has sought to use law as an instrument for social change, arguing landmark cases before the European Court of Human Rights, as well as in the Irish courts and the European Court in Luxembourg. In 1998, Mary Robinson and her husband Nicholas Robinson founded the Irish Centre for European Law at the University of Dublin. A graduate of that university, she was the first woman in its more than 400-year-old history to become its chancellor in 1998. Through her extraordinary public career, Dr. Robinson has advocated for the poor globally, and in particular for women and children in Africa. Her foundation, the Ethical Globalization Initiative, focuses on improving the well-being of women and children and other vulnerable populations through education and public health, and by promoting economic development and trade. EGI is supported by a partnership of the Aspen Institute, Columbia University, where Dr. Robinson is also a professor of practice, and the Swiss-based International Council on Human Rights Policy. Dr. Robinson helped found and presently chairs the Council of Women World Leaders. What a wonderful thought. The Council is a global network of current and former women prime ministers, presidents, and cabinet ministers whose mission is to mobilize the highest level women leaders globally for collective action on issues of critical importance to women and equitable development. Over the past 8 years, the Council has established a global architecture for women at the ministerial level to work collectively with both multilateral institutions and grassroots efforts alike. With Madeleine Albright, who chairs a like-minded organization, the International Assembly of Women Ministers, and in conjunction with the Columbia University Mailman School of Public Health, Dr. Robinson is organizing a major conference, Global Leaders for Women's Health, this June at the Aspen Y River Conference Center. Throughout her life, Dr. Robinson has been a catalyst for new thinking and for change. As a lawyer, academic, politician, president, UN High Commissioner, and foundation leader, she has consistently and eloquently defended individual freedom and promoted respect for the dignity and the human rights of every human being. We are very pleased to have Dr. Mary Robinson open this summit on safe womanhood.
This initiative speaks to my heart because when I had finished my 5-year term as High Commissioner, I was aware that there was an opportunity to focus not so much on the frontline egregious violations of human rights, but on the deeper background to why we had such an unfair and unequal world. So with a small number of colleagues, we established what we called the Ethical Globalization Initiative. And of course, my Irish friends immediately said that that was a very highfalutin title for a very small initiative, which is very correct on their part. So my response was to lengthen the title. And it's now called Realizing Rights, the Ethical Globalization Initiative. And realizing rights has two meanings: that everyone in the world should realize their birthright since the Universal Declaration of Human Rights, Article 1 of which says we are all free and equal in dignity and rights, interestingly putting dignity before rights. And secondly, those with power should realize, meaning implement, those rights. And we decided to look at the impact of globalization on our world, either for good or very often widening the divides, and to focus on 3 areas. And one of those areas is the human right to health. and we have a particular focus on women's health. So this initiative of establishing a global women's health initiative is one that I truly welcome. As Judith Roden has so graphically described, we gather here today at a critical moment in our history. Never before have we been so acutely aware of the scope and seriousness of the global women's health crisis. In Africa alone, close to 5,000 women are newly infected with HIV and AIDS virus every day, and women comprise 58% of those infected. If you look at the figure for girls between 15 and 24, I now understand it's about 62% of those infected. And I was very struck when we were organizing a conference in Botswana a year ago, looking at the impact of stigma and discrimination on women's access to treatment and indeed access to prevention. We had a dinner the evening before with the speakers at the conference, and we were discussing the inadequacy of the ABC approach, abstinence, be faithful, use condoms. And there was a young Ethiopian there, and she was helping to organize the conference, but she sort of raised her voice, she said, why do we focus on the first 3 letters of the alphabet? Why is there always that focus on ABC? And so I turned to her and I said, well, what would you do with DEF? And she thought for a minute, and she said, don't eliminate the future. And I was so struck by that. You know, this is her world. She knows the figures in Ethiopia. She knows how much worse it is for her age group. So it's as stark as that. Don't eliminate the future. And yet, just 17% of resources for HIV and AIDS actually go towards women. So that's something we have to look at and address that imbalance. And we know also, sadly, that married women are often at greater risk of contracting HIV and AIDS than their unmarried counterparts. Again, because of a power relationship, because of their inability to say no, because of their inability to have their husband protect them by using a condom. In other areas of women's health, more than 500,000 women die every year from complications in pregnancy and childbirth that are completely preventable. And issues in women's sexual and reproductive health continue to be challenged in all parts of the world, and we all know that situation is not getting better. Judith referred to the 10th anniversary of the Beijing conference. It's striking that we're not having an official marking of that 10th anniversary as we did for Beijing +5, because we would be afraid that rather than move forward, we might be slipping backwards at the international level with repercussions at national level. And we know that an estimated 200 million women who wish to space or limit pregnancies don't have the means to do so. Women's access to basic health care services the world over continues to be dismally low. Factors such as discrimination, stigma, lack of resources to pay for medicines or treatment, inability to leave home to travel to clinics, violence against women, and insensitivity to the social and economic barriers women face all contribute to the inescapable fact that millions of women are dying unnecessarily, are doing so on our watch. Paul Hunt, the UN Special Rapporteur on Right to Health, put it this way in his first report to the Commission on Human Rights, and I quote, "Systematic discrimination based on gender impedes women's access to health and hampers their ability to respond to the consequences of ill health for themselves and their family. Factors that compound the vulnerability of women to ill health include a lack of access to information, education, and services necessary to ensure sexual and reproductive health, violence, including sexual violence, harmful traditional practices, and lack of legal capacity and equality in family matters." Yes, there is a crisis, and it is of global proportions. Yet, at the same time, there's an unparalleled opportunity to rise to meet this challenge. Never before has there been the combination of the knowledge, the resources, the sensitivity and global focus on the particular challenges women and girls face with regard to their health. For example, UNAIDS identified women and AIDS as the key issue in their 2004 report, declaring, HIV and AIDS has a woman's face. The 8 Millennium Development Goals include 3 goals related to the health of women and girls, as you'll recall, to reduce child mortality, to improve maternal health, and to combat HIV and AIDS and other diseases. Another clear goal is to promote gender equality and empower women. And as we realize, there is an extraordinarily important meeting in September of this year of the General Assembly to review the Millennium Development Goals after 5 years and to explicitly address the effectiveness of efforts to date to meet them. I'm going to come back to that because I think that has to be part of our focus in changing the power dynamics. Because the launch of the Global Women's Health Initiative, with the aim of generating new knowledge about interdisciplinary approaches to women's health, is timely, but it's not sufficient. We have to alter the power dynamics in order to ensure that the health of women and girls gets the priority it deserves, in order, in Judith Roden's words, that we do have a culture of safety for women, and that is bottom-up and secure. And therefore, I want to spend a little time looking at the emerging evidence of women's leadership on this issue and how we can try to link that women's leadership at different levels with this Global Women's Health Initiative. So let me give a range of actions that I've personally been aware of in recent months, and I'm sure that many of you gathered here in this audience will know of other similar initiatives, but they're not connected. They're not gathering in effectively the energies that could be there. The first initiative that I just referred to has been taken by the body that Judith Roden described, the Council of Women World Leaders, which I have the honour currently to chair, together with the Ministerial Assembly, which Madeleine Albright chairs. We've established a network of women ministers of health, which will hold its second meeting at the World Health Assembly in Geneva next month, and some of those ministers will come to the conference that was referred to, which will take place in June. We've learned that bringing together women ministers in their portfolio can be very empowering of individual ministers and can make them an effective group. Perhaps the most effective to date has been the network of women ministers of the environment, who made a huge impact on the World Conference on Sustainable Development in Johannesburg, and who are meeting annually in link with the UN Environmental Programme, but are also having special meetings on women, water and sanitation and other issues. So we hope that this network of women ministers will become a force for change at the global level, including in the World Health Assembly. The second initiative is the Bellagio Global Women's Action Network for Children. This was convened by Marion Wright Edelman in the lead, together with Queen Rani of Jordan, Madeleine Albright, Gracia Michel and myself. And we met first in February 2004. And looking at the kind of issues that we're talking about in this Penn summit, we decided on 2 priority issues: girls' education and maternal mortality. And this Bellagio Women's Action Network is now following up. Can we connect? What are the links that could be formed? There's a very interesting initiative taken by African women. The recently formed African Women's Millennium Initiative for Fighting Poverty Through Gender Equality, which goes under the heading of AWOMI, A-W-O-M-I, and I serve on the steering committee of AWOMI, is committed to linking African women's leadership at top and at grassroots level to bring a strong gender perspective to the implementation in African countries of the Millennium Development Goals. Recently, I attended a meeting in San Diego of women in philanthropy, and they were discussing their new mission statement, which is as follows: leading philanthropy to leverage the power of women and girls to create a just and peaceful world. What struck me about that mission statement was that it was very much looking out at the world, whereas I've had a sense that a good deal of philanthropy, and even women's philanthropy in this country until now, has tended to have a more local focus. And I'm aware of the funds that fund globally, the Global Fund for Women and other funds. Indeed, I chair one of those funds, the Fund for Global Human Rights. But to have women in philanthropy, which represents women in more than 200 foundations, either as heads of those foundations or because they are foundations that have been established by women, to have their mission statement be leading philanthropy to leverage the power of women and girls to create a just and peaceful world seems to be again a new link in the possible synergies that we have to create and energies that we have to gather in. And businesswomen are also becoming involved. I was asked some time ago to help to co-found the Businesswomen's Initiative against HIV and AIDS. The person who asked me, Dr. Marianne Leeper, is a person whose doctorate was obtained in the pharmaceutical sector, and she, having worked as a senior executive in a pharmaceutical company, about 8 years ago, formed the Female Health Company and the Female Health Foundation with a view to improving access to prevention of women and girls in the context of HIV and AIDS. She developed the only FDA-approved female condom, but her approach is a broad, holistic one, taking in all aspects. And she asked me to help to work to link the problem-solving capacities and energies and the sheer woman power of businesswomen. And on the 19th of May in New York, we will have a round table to launch this Businesswomen's Initiative against HIV and AIDS. And the last of these kinds of initiatives that I wanted to refer to is very much a grassroots one, because the idea is to link from the top down and bottom up. It's the international community of women living with AIDS. It's a worldwide community, ICW. They were very prominent and very energizing at the Bangkok conference on HIV and AIDS last year. And I have the honor to have been invited to be a patron of this community. To me, in any initiatives to address that issue, it's extraordinarily important that women who are the experts because they're living with the problem be fully involved. And my question is, how do we develop more linkages, more synergies, and more bottom-up and top-down practical cooperation to realize the full potential of these initiatives? How do we link the academic research and expertise which the Global Women's Health Initiative will represent with networks of women worldwide who can change the power dynamics and focus on implementation of women's health services? I hope that this will be part of the conversation. Indeed, I'd like to use my remarks to reflect not so much on lessons learned, but instead on the lessons still to be learned in using women's political leadership, the international human rights framework and mechanisms to improve women's and girls' health in an increasingly interconnected, yet increasingly divided world. What I'd like to do, in other words, with you, is start a conversation which I hope will continue throughout this conference on what we as women need to be doing to scale up our best practices and our most promising interventions on behalf of women and girls. How do we take the practical experience gathered to date in applying rights-based thinking and tools to health challenges and craft an agenda for wider action at every level, local, national, regional and international, which involves women's political leadership, more committed health and human rights professionals, more attention from governments, and more parts of wider civil society in the years ahead. In my view, the need for more effective women's leadership is critical. Why, for example, have efforts to provide HIV and AIDS prevention and treatment for women and girls in Botswana fallen far short of their goals, especially for women, even with the significant resources and broad campaigns on behalf of the Bill and Melinda Gates Foundation, Merck, and the government of Botswana? There is a gap between the resourcing for implementation and what's actually happening on the ground. And that gap is a gap of a knowledge of the cultural, economic, and other barriers. Why is there only one global example of a large-scale, highly effective maternal mortality campaign, the Safe Motherhood campaign in Sri Lanka, that has shown dramatic decreases in rates of maternal mortality? Why have technologies that give women the ability to directly protect themselves against HIV and AIDS, the female condom and microbicides, been so difficult to fund and so difficult to bring to those who need them most? That is, women who cannot negotiate with their partners to get them to use a condom. More is at play, and I would suggest that our discussions over the next few days must dig deep into the issues of power and rights for women as a significant determinant in outcomes for improving global women's health. As the UN Millennium Project Task Force on Child and Maternal Health stated so clearly in the report actually entitled, "Who's Got the Power?" In order to make progress towards meeting the Millennium Goals on health, we must recognize that the challenge of implementation is, and I quote them, social, economic, cultural, and unavoidably political, in the sense that it relates to the distribution of power and resources. The grim statistics that characterize women's health today are ultimately a function of complex social, political, and economic systems. Technical interventions are critical. Health workers, medicines, contraceptives, equipment, safe blood supplies, distribution systems, and the like are desperately needed. Yet hard experience tells us that technical interventions are never enough. An effective and equitable health system for women must explicitly recognize and address the range of barriers that women and girls face. And the stakes are high because the health field is littered with the remains of major initiatives devoting millions of dollars to interventions that ultimately failed to improve access and utilization of life-saving services, particularly for the poor. For example, the training and deployment of 56,000 community midwives in Indonesia, which was largely unconnected from and unsupported by the health system, had little impact on utilization of obstetric emergency care and failed to reduce maternal mortality. Again, the Child Survival and Safe Motherhood Initiative, a $300 million program launched in India in the 90s to upgrade first referral units, has also had much less impact on women's mortality than had been hoped. Subsequent evaluation shows that even when equipment was brought and delivered, where there were no monitoring and evaluation systems, where there were no accountability mechanisms, there was ultimately no meaningful, sustainable impact on maternal mortality. Many of the barriers to improved health that women in the developing world face are cultural, behavioral, and based on unequal power relationships between men and women. So a fundamental element in efforts to address these issues must and should rest on a rights-based framework. Critical elements of a human rights approach bring practical tools to the table to mobilize and improve women's health. The principles of equal treatment, of non-discrimination, of participation and empowerment, of attention to the most vulnerable are the key principles embodied in the Universal Declaration of Human Rights and subsequent covenants and conventions. In this instance, obviously, the main instruments are the International Convention on Economic, Social, and Cultural Rights, the Convention for the Elimination of Discrimination Against Women, and the Convention on the Rights of the Child, all of which have been ratified by the vast majority of nations. These tools, these opportunities to link to the commitments of states through a rights-based approach have practical and pragmatic value and have provided the structure for path-breaking efforts to health equity. Just over a week ago, I participated in a major conference at Emory University specifically on a rights-based approach to health. And one suggestion I would make for follow-up of this Global Women's Health Initiative is that there would be a link with Emory and that the papers of that conference would be circulated so that they can be part of the background for further work. And I've seen the value at grassroots level of a rights-based approach. Indeed, we all admired the pioneering work of the Treatment Action Campaign in South Africa, which relied heavily on the principle of equal access to treatment in its successful court cases. I was impressed on a recent visit to Mozambique with the work being done on the ground, supported by Oxfam America, among others, for a new family law which protects the right of women in customary marriages with regard to property and custody rights and equal decision-making authority within the household. The health impacts of such a law are many. Women needn't fear losing their property or their children if they find that they are HIV positive. And laws protecting equal decision-making in the household can promote healthier family practices. The use of a rights framework in these cases helped to mobilize civil society, local leaders and others, and they can now hold their government accountable to principles of fairness and equal rights. And in these cases, and many more, it's poor women who are the leading beneficiaries. While it's important to recall that overall the average health in most countries did improve during the latter part of the 20th century, it's also true that today, at the start of this new century, inequalities in health status and access to health care globally are still wide and deep. And what is worse, all indications are that these divides are, if anything, growing. The inequalities are linked to profound injustices which feed into a growing sense of insecurity, confronting rich and poor alike. And our efforts to address the realities of global health inequities have not been effective because we have not, as I said, harnessed women's leadership effectively. But there is, I think, a real opportunity, and one that I said I would come back to at the beginning of my talk. The fact that the world shares a global agenda in tackling poverty, the Millennium Development Goals. These are, as you know, the central agenda of the agencies of the United Nations, of the World Bank, of national governments, and of donor governments in their work and in the approach to tackling poverty. But the Millennium Goals have until recently been very problematical for many grassroots women's groups. And this is another issue that I would like us to look at quite closely. The Women's International Coalition for Economic Justice held a useful seminar in NYU, New York University, in early 2004 on the title, Seeking Accountability on Women's Human Rights. Women Debate the UN Millennium Development Goals. At that time, many women's organizations were very critical of the Millennium Development Goals, the MDGs, which omitted much of the Beijing agenda on sexual and reproductive health and on violence against women. Now, because of hard work by some members of the task forces involved in the Millennium Project, and that was work which the initiative which I lead, EGI, supported, and other human rights experts became involved, I believe that an important shift, and a very welcome shift, has taken place. The human rights framework has been reinserted, and if you like, the MDGs are now rerouted in a broader human rights framework. The final report of the Millennium Project, Investing in Development, stresses, and I quote here, that the human rights framework, as outlined, for example, in the Convention on the Rights of the Child and the Convention on the Elimination of All Forms of Discrimination Against Women, is an essential prerequisite to achieving all the Millennium Development Goals. but there has been no systematic effort to integrate development planning with a human rights framework, even though such integration has tremendous potential and relevance." End quote. The report goes on to make a number of helpful recommendations for moving forward. For example, that poverty reduction strategies should refer specifically, and again I quote, to the international human rights obligations the country has voluntarily undertaken. This could take the form of a human rights assessment, similar to the way the World Bank conducts environmental assessments before undertaking projects. End quote. I believe that there is an extraordinarily valuable opportunity for women's groups working together as never before to insist on the implementation of the MDGs with a strong human rights and gender perspective, which will help to redress some of the current power imbalance. I think the question we have to ask ourselves is, are we ready for the challenge? Have we done our homework? Can we in fact link in to this agenda over the next 10 years that is to have those in poverty and hunger, to have every child going into primary school, to make the impact on child mortality, maternal mortality, gender inequality, environmental degradation, etc. While these debates on health equity and equal access continue at the global level between rich and poor nations and with multinational institutions, important efforts are underway within less developed countries, and they are very geared to implementation of the MDGs and to issues of bringing women's rights and health to the forefront. And again, I just wanted to refer briefly to two initiatives that the project I'm leading is supporting with a number of other partners. The first is an initiative which we've joined with the International Centre for Research on Women, and Geeta Ragupta, who is here, will also perhaps touch on this, and with the Association of European Parliaments for Africa and the Centre for Study of AIDS in the University of Pretoria and the International Community of Women Living with AIDS. It's a multi-year effort to build the capacity of African parliamentarians to advocate for increased access to healthcare for women. Supported by the Bill and Melinda Gates Foundation and entitled Parliamentarians for Women's Health, this effort will build a cadre of national leaders in countries that include Botswana, Namibia, Tanzania, and Kenya, and will provide them with the knowledge, the tools, and increase their sensitivity to address women's unmet health needs. Is it possible for this Global Women's Health Initiative to be part of a backdrop of using the interdisciplinary research to ensure that parliamentarians, particularly women parliamentarians in those countries, will take the necessary initiatives on legislation, on campaigns, on policy priorities in those countries. Another effort that we are making is the conference which Judith Roden referred to. It's a conference taking place in Aspen Y River in early June on innovations in supporting local health systems for global women's health, a leaders' symposium. To a certain extent, the thinking behind this has been very much a recognition that unless we can strengthen health systems at the district and sub-district level, it will be difficult to have the quality of care and health services for the poorest women, the women in the village that we must most focus on. And this meeting will gather a group of ministers of health, of senior civil service leaders, civil society representatives and others to discuss creative efforts to manage, support and monitor the provision of care for women in maternal mortality, HIV and AIDS, and reproductive health in district and sub-district health facilities in the developing world. The long-term goals of this initiative are to build again a group of ministers of health and other senior leaders who will, over time, take this pilot and exchange it in link with other political leaders in the management and monitoring of healthcare systems for women. And there is a quote by Lynn Friedman, who chaired the task force report on child health and maternal health of the Millennium Project, which I think sums up the shift that I've been pointing to and encouraging us to think about. It's a shift from thinking of women as victims and vulnerable to bringing about a sense of the importance of women as actors for change. What she said was as follows: women and children, a tagline for vulnerability and SOS for rescue, a trigger for pangs of guilt. Change must begin right there. The Millennium Development Goals are not a charity ball. The women and children who make up the statistics that drive the goals are citizens of their countries and of the world. They are the present and future workers in their economies, caregivers for their families, stewards of the environment, innovators of technology. They are human beings. They have rights, entitlements to the conditions, including access to healthcare, that will enable them to protect and promote their health, to participate meaningfully in the decisions that affect their lives, and to demand accountability from the people and institutions that have the duty to take steps to fulfill those rights. In a way that captures what I believe you had in mind here in the Penn Summit in launching this Women's World Health Initiative. So how do we ensure that this Penn Summit will gather in effectively and in a sustainable way the energies and expertise necessary to make a sustainable difference in relation to women's health, particularly women's health in the poorest countries? Certainly, I, without hesitation, pledge my own commitment and that of my colleagues in EGI to the Global Women's Health Initiative. I hope that we can remain in an active contact with you in the more activist initiatives that we are taking, the linkages that we are seeking to forge with the networks of women who are seeking to make a difference within their sphere of activity, and that together we can ensure that what is happening over these 2 days will actually turn the tide, and that from now on we will see that together we can really go forward and make that difference for women worldwide.